I'm Jeanette Schmidt, the nurse educator at Parkside OB-GYN. Let's explore some common pregnancy symptoms. For the second trimester, these are common symptoms you may experience around weeks 13 to 27. I do want you to know that some of your symptoms from the first trimester may still linger a little bit. And then you may start experiencing a few new ones. But as the nausea dissipates and their energy starts to return, many women report feeling much better as they enter the second trimester. We will just start with the not so comfortable things to discuss. You might notice an increase in vaginal discharge as your pregnancy progresses. This alone is not a reason for worry or concern. As levels of the hormone progesterone increase in your body, the amount of discharge from the vagina will also increase. This is also a way to reduce the risk of infections and is part of how the vagina maintains its health. So, what can you do to help? Well, you don't actually have to do anything for increased vaginal discharge as long as it doesn't have an odor. A panty liner may be helpful if it helps you feel more comfortable. Reach out to one of your providers, though, if you notice a change in the color or odor of vaginal discharge. If you notice itching, burning, swelling, or soreness around the vagina, or if you develop pelvic pain. Have you found yourself being a little breathless doing simple tasks like just climbing a few stairs? This is actually really common and can start even in the first trimester, and mild breathlessness isn't a reason for concern. So, why is it happening? Well, the blood volume in your body actually increases significantly during pregnancy, and this means that your heart and lungs have to work a bit harder. Your body's demand for oxygen increases too. And as the trimester progresses and your uterus grows, it begins to take up more space, making it feel like your lungs aren't expanding as usual. These factors all make you feel a little breathless and can make you feel like your endurance is lowering, but it's really just related to the changes happening in your body that are normal with pregnancy. So, what can help with this? It's important to listen to your body. When you're breathless, take a rest. Take a few slow, deep breaths in through your nose and then out through your mouth. If you're exercising, you should be able to hold a conversation. If you are too short of breath to do this, you need to take it a little easier. Again, listen to your body. Another new symptom that can pop up in second trimester is nosebleeds. They are pretty common. Again, these alone are not actually a reason for concern. The reason women tend to get nosebleeds during this time of their pregnancy is that increase of blood volume and hormonal changes all occurring, they cause the blood vessels in your nose to expand. And it's withstanding a lot of pressure because of that increased volume. This can cause them to rupture more easily, and that results in a nosebleed. There's a few things you can do to kind of reduce your risk of a nosebleed. One thing you can do is use a humidifier and also stay well hydrated. These can reduce your risk. If you do experience a nosebleed, pinch your nostrils together for about 10 minutes and keep your head upright or tilted slightly forward. An ice pack can also help because the cold will constrict the blood vessels and help stop the bleeding. We don't want you to tip your head backwards, though, when you're trying to stop a nosebleed. This actually puts more pressure on the vessels and can also increase your risk of choking. If you experience repeated or prolonged nosebleeds, reach out to a provider. They may need to assess for some other conditions. Expectant women often begin to experience heartburn or indigestion during the second trimester, and it can linger throughout the remainder of the pregnancy. And this happens because the hormones released in pregnancy can cause the muscles of the esophagus and the stomach to relax. And then as your baby grows, so does your uterus, which can begin to press up against your stomach with enough pressure to cause acid to kind of travel from the stomach back into the esophagus because that valve that separates the two just isn't as tight. To help with occasional heartburn, over-the-counter medicines made of calcium carbonate, such as Tums or Rolaids, can be helpful. Avoid heartburn medicines that contain sodium or that list aluminum on the label. Also, it's important to avoid Alka-Seltzer because it can contain aspirin. Some things you can do are to eat smaller meals. You can avoid foods that are greasy or spicy, and try not to lay down within about 30 minutes of eating in order to allow your stomach time to fully empty. Do call a provider though if you find that you're taking over the counter antacids daily for relief. You may need a longer acting acid reducer to prevent the heartburn instead of just taking medication to relieve it. And finally, you might notice some skin changes, including patches of darker skin. And this often will occur on the face, and it's known as melasma or even cholasma, the mask of pregnancy. The good news is that it's just cosmetic, it won't affect your baby in any way. So, why does this happen? Well, the hormones in pregnancy, especially estrogen and progesterone, they can lead to hyperpigmentation, which is an increase of melanin that is created in a response to these hormones. You may also notice other areas of your skin darkening, such as your areola and nipples, your armpits, and sometimes women even get a line from their belly button all the way down to their pubic bone. So, what can help? These patches are not a medical concern, they're just cosmetic. So you should know that they should not be itchy or irritated or sore. If they are, that's not the normal skin changes related to pregnancy, and you should definitely reach out to a provider. If you want to help minimize the hyperpigmentation, some things you can do are apply sunscreen when you're going to be in the sun, try to remain in the shade, dress in clothing that has UV protection, and use gentle skincare products. The condition is likely to fade away over time once you deliver, but it can take a few months. And there you have it. Thanks for taking time to learn more about some of the most common symptoms during the second trimester of pregnancy. Please remember this information is intended for patients of Parkside OB-GYN and is also very general. Always follow the directions and advice of your own healthcare provider regarding your specific symptoms and needs.